I'm live. I'm live. I'm live. I think I'm live on everything now. All right, we're up. We're running on Instagram, YouTube, Facebook, live. So, as people jump on, we'll get your questions and we'll see what we talk about today. I'm just trying to get all my streams refreshed. Hey, Gretchen, how's it going? And hey, Nicole. Hey, you guys, welcome. I'm doing a three-way live stream. I got Facebook here, I got Instagram there, I got YouTube there. So if you have questions, put them in the chat and I'll answer your questions. And I'm just still trying to figure out YouTube. So if you guys have questions, put them in the comments there and I'll be happy to answer them. Let me just get one more feed going here. See if I can find myself. YouTube is not receiving enough video. Oh, and by the way, I may have to go have a baby. So this may get cut off quicker than I wanted to. But recent thoughts on, I'm not sure what B2 means, B2 breast implant illness. There's not great data to really answer that question. I know the FDA is constantly reviewing this stuff. So I'm not an expert on breast implant illness. You know, there's some data on leukemia associated with textured breast implants, but that one's still kind of very early as well. So I don't think we have great information on it, honestly, to really say what the answer is to that question. So sorry. I would definitely say if you have questions, chat with your friendly plastic surgeons. They're going to know a lot more about it than me. Let's see, Bethany, any tips to help with postpartum hair loss? You know, honestly, we were talking about this last time, actually. So it's the old telogen effluvium, TE. And TE is one of those things that just happens. It goes away. It's not a permanent hair loss situation. So I get a lot of visits in the office. People are worried about their hair loss. But the honest answer is it goes away all by itself. Hey, it looks like maybe YouTube's working. If anybody is on YouTube, let me know. Put something in the chat. I'm not sure how well it's really working on YouTube today. Something's going on. Let's see. No, they tout replacement. Yeah, I'm really not sure. Any tips for conceiving after second miscarriage? So you're watching this on Circle of Life's Facebook page, Instagram feed, on my YouTube channel, which is, if I'll just put it in the comments for you. If you just go to West D Ski, I'll type it in. Just go to YouTube and search for that, West D Ski. There's a video on there under the infertility playlist that talks about evaluation of recurrent miscarriage. So I would definitely check that out. And I would do the things that I talk about testing-wise in that video. But the gist of it is, evaluating for autoimmune kind of stuff, also evaluating for uterine abnormalities, sometimes chromosomal abnormalities. So I kind of go through all that in a lot of detail on that video. So check it out and let me know what you think. Put a comment in the video if you learned something or if you liked it. Thanks. Let's see. Hey, it looks like maybe YouTube's working. 3 mature follicles we triggered. Will having all 3 increased chances of pregnancy? It might. That's the idea of sort of super ovulation, is to get as many follicles going as you can. And hey, Kayla, and hopefully one of them takes. So that's the idea. Let me know if you're watching on YouTube. It looks super jumpy to me, but let me know if it's looking super jumpy on YouTube. I'm not sure what's going on with YouTube today. All right. Hey, we got all kinds of folks jumping up here on Facebook. So let me see. Bailey, sister-in-law is 37, 38, feet are swollen, starting to spread. Yep. Yeah. What a doctor thinks. I mean, the only question really is blood pressure. So, a lot of people have swelling. So swelling is so common that it's no longer part of the criteria for preeclampsia even. So it's all about your blood pressure and if you have protein in the urine. So if blood pressure is normal, then we don't really worry about it. I do agree with the idea of just kind of get your feet up. Delivery will be the cure. But that's about it. As long as blood pressure is normal, we're fine. Hi, Kimberly. How's it going? Kiera, recently heard working out could overstrengthen your pelvic floor, make it more difficult. No, definitely not. Matter of fact, some of the best deliveries I've seen are CrossFit, people who, I had like a patient who's trained for an Ironman. So basically, the more physically active you are, the better. So don't worry about making your pelvis too strong or your pelvic floor too strong. You're not going to hurt a thing. And in my experiences, most of those deliveries go really well. Let's see. Bethany says, how long is it normal to experience bleeding after getting an IUD? Got it placed 6 weeks postpartum, 3 months, still bleeding. Not enough to be, yeah, just annoying. So I tell people kind of like whatever you're having at 6 months with a progesterone IUD is what you can expect going forward. So I would give it that 6-month window and see how it's going at that point. And whatever you have at 6 months is pretty much what you can count on for the remainder of the time you use the IUD. So you still got some time. Hey, Des, how's it going? How's the baby? Let's see if anybody had questions over here. If you have a question on Instagram, feel free to put it in the comments. I don't see any questions at the moment over here, so we'll keep going. Hey, Charlene. Hi, Laura. How's it going? YouTube is a little bit laggy today. Sorry. I don't know what's going on with YouTube today. It's kind of moody, but it looks like Instagram and Facebook are working, so 2 out of 3 ain't bad. Laren says after section number 2, but so 4 to 6 weeks postpartum, so anywhere in that range is just fine for your postpartum checkup. Let's see. Rachel went past due date with first pregnancy. Is it an indication it'll go full term with twins? No, but it's a good thing. I mean, so the way I always kind of think of it is the biggest risk factor for preterm birth is history of a previous preterm birth. And a sort of protective factor is if you, in other words, a lower risk for preterm births if you have a history of term birth. So I would look at it like that, but twins are kind of a wild card. You never really know what's going to happen with twins. So you could go early just because of twins. All right. And thanks for the nice comments there, Kimberly. Let's see. After miscarriage, when would you expect the first period? Potentially within, about a month or so. And there is a video on my YouTube channel that talks about this, like how long should you wait to try to get pregnant after miscarriage? And the answer is, pretty much the stops go for it. There's evidence now that the sooner you start trying, the lower your risk of miscarriage and the higher the rate of pregnancy, so which is kind of opposite of what we always thought. So I tell people just don't delay, just go ahead and get started. Let's see, got some comments coming in on YouTube. Thanks guys for hanging in there. I heard it's kind of laggy. 16 weeks pregnant, getting headaches almost every day for 2 weeks. Is this normal? It's super common. Yeah, headaches. Headaches are one of those things that is not super well understood. I have a lot of theories on why you might have headaches. The things that I tell people to try are make sure you're staying well hydrated. Make sure you're eating so you're not starving. Starvation can create some ketones, and the ketones can trigger headaches. A little bit of caffeine is probably okay in a low dose. Say under 50 milligrams a day, and then Tylenol's fine. So those are the things I would recommend trying in terms of reducing your headaches. Like there's a Excedrin migraine, which is just Tylenol with caffeine, is also fine to take. And there is growing evidence that using the standard like Imitrex and other sumatriptan, stuff like that, are safe in pregnancy. So we are starting to use those more as well if we've kind of gone through all the other stuff and the headaches are still bugging you. Let's see, another question. How does obesity affect pregnancy? Primarily increased risk of gestational diabetes, hypertension, and C-section. Those would be the higher risks related to obesity. The big thing you do there to reduce your risk is not really to gain excessive weight beyond say 15 pounds kind of max if you can. And there is evidence in obese patients that even losing some weight during pregnancy is not harmful for baby. So basically we monitor the growth to be sure that the baby's growing well with anyone who's obese. And assuming the baby's growing well, if you're not gaining weight and even if you're losing it, it's okay. All right. Hey guys on Instagram, if you have questions, put them in the chat. I haven't seen any questions, so I'm kind of keeping an eye out though. Let's see. Here we go. We're going back to Facebook because we got lots of questions piling up over here. Let's see. Last yearly had a cyst on your uterus, something you should worry about. Also have endometriosis. Cyst on the uterus sounds kind of like maybe you have a fibroid. You don't really have cysts per se. You can have a Nabothian cyst in the cervix, which is absolutely nothing. If it was a fibroid and your periods aren't bad and you're not having pelvic pain, then it's not a big deal probably. it is potentially a thing for fertility. So if you're trying to get pregnant, it's important to know, where's the fibroid, how big is it, and things like that. So without much information, it's hard to say much more than that. Okay, let's see. Changes after having tubes removed. Is it normal to have drastic changes? No. Heavy periods is more, we think, probably like whatever method of birth control you were doing before. If you stop it, then that may lead to heavier periods, longer, more painful, PMS, etc. Yeah, we don't, happy to, make an appointment, get evaluated. There's things that can be done to help with all these symptoms. We don't necessarily blame it on the tubal, I think is the main thing to understand. It may more be a reflection of stopping whatever method of birth control you were using before, and now your period's are bad because you stopped your birth control pills or whatever. So that's kind of what we think. All right, so, and just like that, I'm all caught up. Let's see, what is going on with YouTube? YouTube is not behaving. Let's see if I can change the settings. Let's try a faster bit rate. All right, I just changed the settings in YouTube. Let me know if that smooths it out a little bit. I'm all caught up. Hey guys who are jumping on to Instagram, welcome. If you have questions, put them in the little comments there, and I'll be happy to answer your questions. I'm also doing a live stream over on the Facebook page and also YouTube, so I'm like going all over the place. And as a matter of fact, I also have somebody in labor that I may have to jump off of all this and go deliver before too long. So we'll see what happens. Okay, I think I'm all caught up. Yep, I don't see any questions. Oh, here we go. Last cycle, very sharp pain, left side, kind of felt like a cyst. Something you need to get checked out. Only if the pain persists. So it's not uncommon to have a cyst rupture and have some pain. Even ovulation can cause pain. So it could have been either. But if it went away, then I'm not really worried. So it's more about like persistent pain. So I think it's more a matter of that rather than if you had pain for a couple of days and now it's gone. So I think if it persists, yeah, get it checked out. And if it's not persistent, then don't worry about it. Let me know on YouTube, guys, if you are seeing the stream. Does it look any better? Does it look any worse? I just changed the settings. I'm trying to make it function better. Okay, I'm going to take this phone call. You guys put your questions in the chat, and I'll be right back. I'm on call. 1 second. Dr. Dave? Yeah. Yep. Okay. How many weeks? Yeah, let's check her cervix and then if there's nothing going on, we'll check her in an hour, so let's make sure there's no change. So, cool, thanks. No, let's just start with checking her and see what we got. Thanks. I'm back. Okay, let's see. So Shar says, had a miscarriage 2 months ago, trying again, started taking Clomid. Is it too soon? No, it's not too soon. I was talking about that just a minute ago, and you might have missed it because we talked about that a few minutes ago. But basically, no. The answer is the sooner you start trying, the better when it comes to miscarriage risk. So start trying right away. Numbness after, foot in delivery, normal. Maybe. Let's think about that for a minute. So, is it your whole foot? Is it one side of the foot? That'd be helpful to know. Do you have swelling in that foot? Those would be the things that I would, if you can tell me that, Des, then I can probably tell you. Okay, let's see. Keto diet and PCOS. Keto's fine, but don't do it if you're trying to get pregnant. So there's a video on my YouTube channel that talks about this in more detail. But the gist of it is, if you're doing keto and you get pregnant, there's a higher risk of spina bifida in the baby. It's not clear why. It's not clear if it's because of the reduced folate in the diet, or is it something to do with being ketotic. So my only advice is don't do it if you're trying to get pregnant. Otherwise, I think it's fine. Laren's asking, is it okay to drive? As long as you're not in pain, as long as you're not taking pain pills. you can get in the car, you can slam on the brakes, then I think it's fine. Yeah, keto can get better for sure, or keto can help PCOS for sure, but the only thing, like I was saying, is if you're trying to get pregnant. Okay, numbness and foot. Okay, so I'm still waiting. Des over here, give me some more info. Whoops, sorry, banging in the phone. Is it your whole foot? Is it half the foot? Is there swelling in the foot? Those kind of things. Let me know. Okay. So, I think I'm all caught up again. So, YouTube's still complaining about the bit rate. I don't know what's going on. I'm going to change it again. All right, you guys, if you have questions, put them in the chat. I may have to go do a delivery soon, so don't hold back. Well, it says it's got a good bit rate. Let's see. Let's go fast. Okay, I'm changing the settings again in YouTube. We'll see if that helps. Okay. No swelling, numbness in toes, and most of the right foot. It's a good question. Is there any weakness in your foot? If it's just numb, it's probably not a big deal. If it was nerve compression, you could get numbness in your whole foot just from some swelling, but if it's not swelling, it's probably not that. If there's no weakness, then I'm not particularly concerned. If there was weakness and numbness, then I think that's kind of one of those go get checked out kind of deals. If there's no weakness, I think wait and see. It probably goes away on its own. You can get some compression of nerves in your lower extremity when you're pushing, but typically only if your legs are up in the stirrups for a long time, which if that I can't say publicly on Instagram. But anyway, if you weren't pushing for a long time, if your legs weren't up in the stirrups for a long time, then nerve compression is unlikely. So if there's no weakness, I think I just wait and see. Come see me if it keeps bugging you. Let's see. Genesis, pregnant with IVF, twins, congrats, and tubal reversal. Don't want a C-section unless medically VBAC. No, a VBAC with twins are fine. Assuming, especially if you've had one prior C-section, and assuming that C-section was a low transverse incision, and even 2 is okay, although most folks would probably be a little squeamish about doing VBAC after 2 sections with twins. I would do it, but I would just have that conversation that I explained to the patient that there's maybe a higher risk of uterine rupture if you've had 2 C-sections versus 1. But if it's 1 C-section, I'd be fine with that. I've VBAC twins all the time, so I don't think there's any big deal. Kevy says, nasty stomach bug going around, so you can start to catch it. Well, only just in the feeling crappy, standpoint. So if you get dehydrated, things like that. So just make sure, first off, trying to get sick. And secondly, if you do, trying to stay hydrated. Don't wait till you feel like you're behind on your fluids before you get help on that. Let's see. Kayla, 36 weeks, having a lot of discharge. What does that mean? It means you're 36 weeks pregnant mostly. So I always say the pregnant cervix is kind of like a runny nose. It just makes a lot of discharge. So in and of itself, not a big deal probably. Brianna, is there anything I can do to better my chance of having VBAC? It's mostly sort of patience, letting labor start on its own. Those are the best pieces of advice. Not being induced is definitely preferable. It reduces your chance of success if you get induced. Although sometimes, you have to for medical reasons, and that's okay. But if you could not be induced, that's preferable. Let's see. Jennifer, 35 weeks pregnant on labetalol for blood pressure, constantly dizzy, blurry vision, legs are weak, jittery. Could be a side effect. But it could also be lower blood pressure if your labetalol is working a little too well. So maybe check your blood pressure. If it's less than 120/80, you could let us know. It could probably reduce your dose of labetalol. Let's see, Heidi, 27 weeks, baby was breech, doesn't move much. Could it be, bottom line on fetal movement is if you can feel 10 movements in an hour, 1 time per day, you're good. So the baby may have just changed positions or whatever, and you might not be feeling it as much in terms of movement, but as long as you can feel 10 movements in an hour, 1 time per day, then that's what I tell people, that's kick counts, you're good. If you can't get that, then my advice is go to labor and delivery and get evaluated just to make sure everything's okay with baby. Let's see, C-section back in November. Should your incision still hurt at times? It can. So I had a knee replacement I don't even remember how long ago now, I'm going to say 7 years ago maybe. and that incision still hurts sometimes. So it's pretty normal, I think. Let's see. 2 C-sections, wondering if scar tissue adhesions could negatively affect. No, it won't affect dilation. Yep, that's okay. Let's see. Over by 37. What are we doing? Yeah. Well, good luck, Genesis. I hope you find somebody that'll work with you. Or come to Utah. We'll take care of you. Let's see. Shar says incompetent cervix. So you'd have to get a cerclage, been pregnant 3 times, lost them all. When do you recommend? What do you recommend? Oh, so we would do what's called a prophylactic cerclage. So you get that placed around 12 or 13 weeks. So you don't wait for bad things to happen. Assuming you've never had a cerclage before, then that's what I would do. So yeah. And if you've had a cerclage and subsequently still delivered preterm, then we have you do what's called an abdominal cerclage, which is a lot bigger deal, and we don't do those routinely, but they do still get done on occasion if you've had a failed prior vaginal cerclage. Let's see. Janica, in your years of practice, have you had to deal with abruption? Yeah, all the time. What to tell you about it? It's in the name, so they happen very abruptly. Imagine that. Risk factors are things like hypertension. So preeclampsia is one of those patient groups that have a higher risk of placental abruption. There are others. I think maybe smokers are higher risk. A lot of them are completely unpredictable, and there were no identified risk factors prior to the abruption happening. Most commonly, it's noted by frequent, very painful, sort of maybe even more painful than normal type contractions, potentially vaginal bleeding, and in the sort of final stages of it, abnormal fetal heart rate tracings that can either trigger a C-section because we got worried about the baby, or maybe are happening right before delivery, which is what happened with my kid 16 years ago, almost 17 years ago. Fortunately, that placental abruption occurred right when my wife was complete, and so she could push, and the doctor pulled the baby out, and it was all good. But if that hadn't been the case, that would have been a C-section for sure, because his heart rate just kind of crashed. They're not all that dramatic. Some of them are kind of really slow motion. Some of them are even chronic. So they're not all as dramatic as I was just describing, but that's kind of like worst case placenta abruption story. So I don't know if that answers your question. If there's something else you had in mind, just put it in the chat, and I'll try to expound upon that. Cool. Okay, you guys, everything's working now. It looks like YouTube is kind of working. Let me know if you're watching on YouTube, if it's still laggy or if it looks smoother. I tried tweaking the settings. I don't know what's going on with it today. It's in a bad mood. I may have to go do a delivery soon. So if you do have a question, don't wait, because I may be jumping off of here anytime. Let's see. Does the mom bleed out if they have uterus? No, it's typically not that dramatic. Delivery is how you stop the bleeding. So it's usually not as dramatic as what you're saying, like mom bleeds out. But you can have significant bleeding. It can lead to need for blood transfusion and things of that nature. But those are, again, rare and few and far between that they're that bad. But it does happen. Okay. So, other questions, if you have them, feel free to put them in there. Still just messing around with the YouTube feed because it's still acting weird. Lagging, but not too bad. Thanks for that. Yeah, I don't know. They changed their software. It's a new thing, and it's different. I don't know what the problem is. But I guess I'm glad it's working somewhat. So thanks for watching. If you're on YouTube, thanks for putting up with it. If you're getting tired of the lagginess, you can jump on Circle of Life's Facebook page or Instagram feed, because they're both going live too. Let's see. Do they put you to sleep when getting cerclage? Yeah, we do ours under IV sedation. That's probably the most common, I would imagine. Some people do them under spinal anesthesia, and that's also totally fine. The Ashbo said, nope, you're awake. I've done them under spinal, and I've done them with IV sedation. I've never done one on somebody who was stone cold awake. But maybe somebody has. Let's see. think I'm all caught up. Let's see. What are some causes of headaches? Oh, I was just talking about that a while ago. The short version is we don't really know. Dehydration, starvation, sleep deprivation, caffeine withdrawal. Those are hormones. Those would probably be your top 4 or 5 answers. So I always try to say address as many of those as you can. Let's see, Amanda, taking progesterone shot once a week, wanting to change the day, get the shot. Yeah, it's fine. As long as you get it once a week, it's no big deal. So that's fine. Hey guys on Instagram, nobody's asked any questions in a while. If you guys have a question, feel free to put it in the chat there, and I'll be happy to answer it. Shar was saying, is the cerclage painful? Not the ones I've done, since I've always done them under some degree of anesthesia. Let's see, missed period, normal, 30 years old, not pregnant. Yeah, I always tell everybody, it's not unusual to miss a period every now and then. It's more of an issue like if you're missing frequently, like every other month you're not having a period, or you're going 3 and 4 months between periods. That ain't normal. That's a common, I'm reading like comments on 3 different pages. If you're sort of going every other month, let's say, that's a fairly common symptom for PCOS, for example. Yeah, so Ashbo said she had a spinal. Yeah, exactly. So that's what I was saying too. I've done them under spinal. I've done them under sedation for cerclage. So cool. Let's see. I think I'm all caught up. If I didn't answer your questions, because I didn't see it, so I'm just kind of rolling back through the questions here to see if I missed anything. I don't think I did. I think I'm all caught up, actually. Okay, well, if you have questions, put them in the chat, and I'll be happy to answer them. Looks like YouTube's working a little better now. Everybody else's streams seems to be going smoothly. So we'll give this a few more minutes. If you have questions, put them in the chat. May have to wrap this up soon for delivery. Waiting on a question. If you are watching and you don't have a question, let me know where you're watching from, just out of curiosity. YouTube, sometimes I get people from ways away. I think the furthest was maybe New Zealand one time, but all over Europe, all over the US. So if you're watching, let me know where you're watching from. If you have a question, put it in the little chat there, and I'll be happy to answer it. Might be wrapping this up soon. Lehigh, all the way from Lehigh. That's cool. Anybody else? Nobody over there? Where are you guys watching from? Syracuse, there you go. Hitting up all the 844s. PBX. Hey. Is it busy? Are you getting a lot of phone calls today? Guess not if you're watching me. Nashville, Tennessee. Oh, that's cool. So I used to live in Asheville, North Carolina. People get this confused all the time. Let's see. How do you increase your estrogen naturally? Not a really, there's really no way that I know of that is a thing. And from Perry. Let's see. Might be a weird question. Okay, this might be a weird question. Twins for second time. Wow. And if everything's okay, you want to do skin to skin. Twins for C-section. So twins especially, it's a little harder to do skin to skin, just because you're getting that second baby out of there, and they're checking out the first baby. So it's probably not practical until they're both kind of out and we know that they're good, and then you can have them. But a lot of times, by the time the nursery's happy that the babies are doing okay, we're like done, and we're rolling out of the OR. So it's kind of hard to do twins skin to skin at a C-section. It's even kind of hard actually to do it vaginally, because you deliver one kid and now we're going after that other kid, and so we have to be monitoring the baby, and so it's kind of hard to put the other baby up there. So it's tricky with twins. It's not as easy for sure. Good question though. Let's see. Twisted ovary, which we call ovarian torsion. Wouldn't get any blood flow. Took a little piece off. Will be harder to conceive. Probably not. And California. Right now you're the winner, Shar. ovarian torsion, assuming, so a lot of times what we do is just untwist that ovary, and the majority of the time the ovary survives. And so assuming that it lives, then it really shouldn't affect your fertility at all. And even if you lost one ovary completely due to ovarian torsion, assuming your other ovary was okay, it really shouldn't affect fertility. So hey, jumping on Instagram, I'm doing a little live broadcast on 3 different platforms. Instagram's over here, YouTube's there, Facebook's there. If you have a question, you can put it in the chat, and I'll be happy to answer it. If you're just jumping on, also I may have to jump off of here in a minute to go do a delivery, so we'll see how much longer we get to be on here. Oh, the UK, Birkenbag wins. So we got Birkenbag on YouTube is watching from the UK, so you win. Good job. That's awesome. Let's see. So if you have questions, stick them in the chat. I'm waiting for a question. In the meantime, I'm just like talking to people about where you're watching from. Wow, my face is like really close to that camera. Let's back that up a little bit. There we go. Is it an option to watch your C-section? Yeah. Which hospital are you delivering at? At McKay, they have a drape that's like 2 layers, and the back layer is the typical surgical paper drape, and then the top layer is plastic. So you can pull back that paper drape, and you can look straight through the plastic and see kind of whatever you can see sort of up and over your belly. But we can also, you can put a mirror in there. Ogden Regional, yeah, they don't have a clear drape at Ogden Regional, but you can sometimes rig like a mirror, and if you can angle it just right, then you can see. And I mean, as far as I'm concerned, you can record it. I mean, if you look at my YouTube channel, there's C-sections on there, so yeah, that's okay. Let's see, brown cervical mucus during ovulation. Yeah, so a little sort of spotting at ovulation is actually kind of common. There's a little dip in your hormone levels right then that sometimes causes a little mid-cycle spotting, and you might see that as brown because it's just a little bit of old blood and coming out with the mucus. So yeah, no big deal. Normal probably. Let's see. I think I'm all caught up. All right, I'm ready for your next question. This is super exciting. If you're watching on Instagram, welcome. Thanks for watching on Instagram. That one's new. I just started doing live broadcasts on Instagram recently just for the heck of it. Some people like that one better. I don't know. We're doing it on Facebook and YouTube also. So if you have a question, you can put it in the chat. We've been going now for how long? 33 minutes. Looks like it's working. Cool. Okay, let's see. Not pregnant, but feet and hands have been swelling a lot more than usual today. Blood pressure is normal. Yeah, fluid retention in the non-pregnant person is probably the most common cause for swelling. You might look at what you've been eating lately. If your diet's been more rich in sodium, then that might lead to some fluid retention. Outside of that, don't have a whole lot else intelligent to say about that one. Let's see. When do you recommend having a girl see for the first time? Yeah. So in the U.S. we do. And you're in Tennessee, I think. So in the U.S. we do PAP starting at 21. So we don't need to see someone prior to age 21 because they don't need a PAP unless they're having problems. So if you're having problems with their period, whether that's pain or heavy bleeding or bad PMS or whatever, happy to see them for any of those kind of gynecological bothering type symptoms. But if they're like totally fine, everything's cool, no problems at all, and not sexually active, then 21, that's all we need. The big thing I just put the plug in there for, and maybe your pediatricians talk to you about it, is just to make sure you're doing the Gardasil. We're seeing a lot less sort of nationwide in terms of abnormal PAPs in this generation that got Gardasil, that first generation. So I definitely put a plug in for Gardasil for sure. Scarlett says, hey Scarlett, how's it going? Let's see, how do you check for ovulation? Cervical mucus changes are one of the most reliable indicators. And then ovulation predictor kits are pretty good. And then you can do day 21 progesterone level to see if it's high. If it's over 10, that's consistent with ovulation. So those would be the simple ways. Don't get regular periods if you're not taking anything. Sounds like you're probably not ovulating. So if you're having no periods or very infrequent periods, sounds like you're probably not ovulating. So you might consider Clomid or Femera to help with ovulation. And there is a video on the YouTube channel you're watching that's called How to Take Clomid or Femera. So maybe check that out. Let's see. Are you more likely to get acne during pregnancy? Yep, for sure. Definitely more likely to get acne during pregnancy. It's the progesterone. So you have much higher levels of progesterone when you're pregnant. And that is kind of like testosterone, and that makes your acne worse. Okay, let's see. What are the best ways to check ovulation? Oh, I was just talking about that. So I was talking about that over here. Did you hear it over there, Annie? Let me know if you heard, if I answered that. I think I did. Cool. I think I'm all caught up. I don't think anybody's watching on Instagram. I think Instagram went dead. Best ways without ovulation tests with irregular periods. I guess that's a little bit different than what I was talking about, but still, cervical mucus is one of the best indicators. Sorry, it's the dog. So yeah, cool. If you have other questions, feel free to stick them in the chat. We'll probably wrap this up here in a minute. Things are starting to dwindle down in terms of frequency of questions. But if you have one, yeah, there you go. Look at that. Good timing. Okay. Does anybody else have a question? There's nobody watching on Instagram as far as I can tell. There are still people watching on YouTube and Facebook, so if you have a question, put it in the chat. I'll wait here a couple minutes and see if anything else pops up. Otherwise, I think we'll maybe wrap it up right there. Just to say a quick thanks to everybody who has been watching, and thanks for your questions, because otherwise I just kind of sit here and wait for somebody to ask me a question. So if you're jumping on, put a question in the chat if you have one. Otherwise, we'll probably call this good for today. Anything to do to promote pregnancy other than just keep trying? So there's 2 or 3 videos on my YouTube channel that I would take a look at. There's one called ways to naturally improve your fertility, or maximizing your natural fertility. So take a look at that. There's a video on there that talks about the risk of non-organic fruits and vegetables. So this was from Harvard's fertility group. Basically the idea being that the residual pesticides that are on conventionally grown fruits and veggies reduce fertility. So I'd look at that one. And then look at the one that talks about maximizing your natural fertility. So I'd take a look at those 2 videos on my YouTube channel. And if you're like, well, what's your YouTube channel? It's, let's see if I can get it to pop up here, Wes. If you go to YouTube and just type in Wes D Ski, that's the quick way to get there. So I just put that in the chat. If you just copy and paste that into YouTube, search for that, then you'll find my channel. And then there's an infertility / trying to conceive or something like that. It's the name of the playlist. And then there's a video called something like maximizing your natural fertility. So check that out, because it talks about that in some detail. Let's see. Not sure if it's related, but urinary problems since your uterus taken out 6 months ago. Not sure if it's related. Yeah, short answer is we don't think so. There's not great evidence to suggest that would be the case. But it's one of those things that, well, if it's bugging you, get it checked out and maybe see. Let's see. How many rounds of Clomid does it normally take? Round 3, starting to work. So my general rule of thumb is, 3, 4, 5 cycles of any particular dose or medication. So if you're ovulating on Clomid, give it 3 or 4 cycles. If you're not ovulating, increase the dose so that you do ovulate, and then give it 3 or 4 cycles. If that's not working, you move on to Femera. And then if Femera is not working, same thing, 2, 3, 4 cycles. Then you move on to injectable fertility drugs. And maybe that's only a round or 2. And if you're not getting anywhere, then it's IVF. So that's kind of the way I think about how, so that somebody doesn't just like get stuck on Clomid at one dose for 6 months and isn't pregnant. Don't want to waste your time there. Let's see. Is it normal to get constipation during your period? Good question. And why? Equally good question. Maybe. So, the motility of your GI tract can be influenced by hormones. Pregnancy is a good example of that. So your GI motility slows down when you're pregnant, and so you're more prone to constipation. So is that in any way similar to getting your period? Probably not, but maybe. But beyond that, I can't think of a good why. So sorry, I don't have a great answer to that question. Let's see. Can you get fixed right after baby's born, or have to wait 24 hours? So kind of depends on, your doctor and where you're delivering and all this kind of stuff. But in general, and also what type of delivery you have. So if you have a C-section, of course you could do it at the C-section. But if you have a vaginal delivery, we're not doing tons of immediate postpartum tubals anymore. And it's a combination of things, one of which is labor and delivery is super busy and it's always hard to get added on. But probably more importantly is that I at least am doing salpingectomies now. So you just remove the tubes entirely. And the reason is that there is evidence that could reduce your risk of ovarian cancer. And so if you're going to do a sterilization procedure, we think the right answer is just remove the tubes, because that could reduce your risk of ovarian cancer, which is really almost impossible to screen for, and usually is diagnosed at a very late stage and bad outcomes and all that. So anything you can do to reduce your risk of ovarian cancer is a good thing. And it's hard to do that type of tubal at a postpartum if you had a vaginal delivery, because now you're trying to make this little bitty incision and get the tubes out. It's pretty hard. So usually what I would counsel people to do is to recover, have the baby recover, go home, and then set up for like a laparoscopic tubal 4 to 6 weeks postpartum, or 6 to 8 weeks postpartum is even better. So that's the usual thing that I do most frequently nowadays for someone who did not have a C-section. All right. I think I'm all caught up. Hey, there's somebody watching on Instagram. Hi, whoever's watching on, is it Angie maybe? Just joined. Whoop, I just banged into the camera. Good job. If you have a question there, Angie, if it's you watching still, just adjusting, put it in the chat there, and I'll be happy to answer it. I'm chatting on Instagram and YouTube and Facebook. And let's see. I think I'm all caught up. So if you have a question, feel free to put it in the chat. Haven't been making any sort of educational videos in a while. I kind of ran out of things to say. These live ones are way more fun, just because I answer you guys' questions directly, and you don't have to wait for me to guess what it was you wanted to know. Let's see. Stormy, does Depo cause weight gain? It definitely can. If quitting Depo, does weight just fall off? Not necessarily. But you do see some weight gain with Depo-Provera, probably through increased appetite, some fluid retention, things of that nature. It's definitely the one that I counsel people, like of all the methods of birth control, I guess any of them could cause weight gain, but probably don't very much. But Depo for sure, I think, is a thing. Okay. I think we're all caught up. So give us another minute or two. Let's see. When can you start working out after C-section? So light physical activity is fine pretty much as soon as you get home from the hospital. I mean, being up and walking and being, mildly active is totally a good thing. And then I think you just kind of build on that. What you don't want to do is like real heavy lifting. You don't want to strain that abdominal incision and, risk a complication there. But aside from like heavy lifting and real strenuous physical activity, I think, you start doing that when you get home and just kind of increase as tolerated. If it doesn't hurt, then it's probably fine, is what I tell people. Let's see. Melina, is it Melina? Am I saying that right? Took an Ovidrel shot, tested out the trigger with pregnancy test. First 4 days, test positive. On 5th day, it was negative. Looks like it was out of your system in 4 days. Yeah, sounds about right. It would depend on the dose exactly. So yeah, but I can't say that I have tested like tons of people with Ovidrel to know how long it's in their system for. But definitely it's in your system for a certain period of time. And then, it's clear to kidneys, so you pee it out. So I think, as you described, it sounds pretty normal to me. So, I think you're fine and normal. And I don't know about, what you said, it usually stays for 10 days. I don't know. I haven't seen that, but I think the way you described it sounds like the normal way I would expect things to go. Let's see. Stormy, could it cause you to gain more weight after having a baby? Yeah, I think that's more to do with just having a couple of kids and life and getting a little bit older maybe, and all that kind of stuff. So I don't think that the Depo is making you gain more per se than it would have otherwise, and probably more to do with just life, 2 kids and all that stuff. Let's see. If baby's dropped and you're having back cramps, could you dilate from baby dropping? Yeah, I mean, you could, but most of the time it doesn't cause any problems. Let's see. If tubes are removed during C-section, is there added risk or more pain during recovery? Nope, doesn't change it a bit. Hey, question. Ashley's got a question. What helps vaginal dryness after a hysterectomy? Estrogen, if you are estrogen deficient, so if you're menopausal or perimenopausal or anything like that, then little vaginal estrogen. And even if you're not, I mean, vaginal estrogen is not going to hurt anything, particularly if you use for a short term. So that's the kind of thing that I would think about. If it's not like all the time vaginal dryness, but more just like, say, for intercourse, then I would just use like one of the over-the-counter lubricants are perfectly fine. Let's see. I think I'm all caught up. Okay, we'll give this like another couple minutes and then probably wrap up for the day. So if you have a question, put it in the chat. You're welcome, Ash. You're welcome, Melina. You're welcome, Stormy. Everybody's welcome. It's all good. Let's see. Are home pregnancy tests reliable? Yeah, they're reliable. They may not pick it up, say, as early as they claim, like by the day of your men's period or whatever, because that varies so much just based on the concentration of the HCG in your urine. So if you're super hydrated, relatively speaking, there's less HCG per ml of urine, so it may be harder for the test to pick it up. But I mean, in general, if you have a positive home pregnancy test, you're pregnant, no question. Let's see. Yeah, Scarlett, all of hers, they were good. Let's see. Can premenopause start at 30? It could, particularly if you have family history. So family history of early menopause is the biggest risk factor for an individual person's own risk of early menopause. So if your mom went through it early, there's a chance you might too. 30 is super young, but it happens. So the one to know about if someone actually was menopausal at 30 is they ought to be tested to see if they are a carrier for Fragile X. So symptoms just like hot flashes, night sweats, irregular periods, a little further apart, a little closer together, a little further apart, that kind of stuff, plus some hot flashes and night sweats, that starts to sound perimenopausal. And that's about it. So yeah, cool. If you guys have a question over there on Instagram, put it in the chat. We're just wrapping it up here in just a minute, doing the live stream and just answering questions and talking about whatever people want to talk about. Let's see. Aislinn, dryness, had the biopsy, came back normal, treated with metronidazole, betamethasone, still bugging me. Yeah, it sort of that chronic vaginitis, it can be difficult. I think probably more than anything, just using lubricants if it's just dryness. And if you haven't, then trying some vaginal estrogen also maybe could help. So those would be the things that I would think about maybe. Okay. Let's see. What are your thoughts on fasting while trying to conceive? No data on that one at all. So we don't have any good data. Can't tell you. No one's really studied it that I'm aware of. Let's see. I have all those, but no period because of Depo. Yeah. Oh, right. Yeah. Yeah. Well, I mean, it's not wrong to get some hormone levels tested and just kind of see where you are, Stormy. It's hard to know otherwise. But they could definitely be affected by the Depo as well. So it's a little tricky. Yeah, fasting, trying to maintain weight with PCOS. Yeah. I mean, we just don't have good data to tell you one way or the other. Is it good, bad, or indifferent? Just because it's not something that I'm aware of that's been studied. Let's see. Baby in September. Did the new IUD. Maybe that's Liletta if I had to guess. Bleeding, spotting, 6 months. Still have it. Check it out. Yeah, it happens. And really, Liletta is the same as Mirena. So if you're saying new and you mean Liletta, then it's really only got a new name brand of the same old IUD. But it could be a Kylena, it could be a Skyla. There's lots of different IUDs out there. The lower dose ones, Kylena and Skyla, you tend to see more spotting than, say, Mirena and Liletta. But even with Mirenas or Lilettas, you can definitely still have irregular bleeding. But if it's been 6 months and it's bothersome, I'd maybe get an ultrasound, just make sure the IUD is positioned normally. And then I think it's easy to say, okay, well, the IUD is in the right spot, everything's fine. It's just hard to know that without checking. But once you've checked that, then I think it's sort of, well, just kind of is what it is. If it's okay, stick with it. If it's not, maybe do something else for birth control. Yeah, cool. All right. I'm not seeing any more questions. So I think we'll wrap it up here. It's been good. Been a good Facebook Friday, YouTube Friday, Instagram Friday. Thanks everybody for your questions. If I didn't, thanks for the thumbs up somebody just gave me. If you have other questions I didn't get to, you can put them in the comments. I do look back at these after, in a couple hours and see if anything else popped up. I can always do a little add-on video response. So yeah, hope everybody has a great weekend. Thanks for watching. See you later. Just joined. Cassandra. Go ahead. Cassandra's got a question. Oh, and now here's another one. It always happens. If I say, okay, I'm leaving, then the questions start popping up. Cassandra, go ahead. Put your question in there. I'll answer it. And then Rainbow Baby Mama from Australia. You win. You got the furthest away. 41. AMH is 5. What can you do to boost it? Nothing, unfortunately. Had 6 back-to-back miscarriages. No reason. I'll test. Yeah. The biggest risk factor, honestly, for recurrent miscarriage at 41 is the age of 41. So egg quality and associated higher risk of chromosomal abnormalities is the main risk factor, probably. Yeah, so I think they're trying to tell you, like, yeah, essentially egg quality is, I think, what they're trying to tell you there. So, yeah, and the AMH doesn't tell you a whole lot outside of the setting of someone who is trying to get pregnant by in vitro. So if you're talking about spontaneous pregnancy, AMH is actually not predictive. Lots of people still do the test, but the data showed that it's not predictive. So age is the main thing. If you haven't had live-born kids, I'd suggest being tested for chromosomal abnormalities like balanced translocations in both you and your partner. And there's a video on my YouTube channel that talks about that evaluation of recurrent miscarriage. I would watch that video and make sure you've done all the stuff that talks about that. Yeah, waiting for that one good egg is absolutely right. That's exactly what it boils down to. But I'd look at that video and just make sure you've had the other tests done, just to be sure. So Cassandra, I'm 28 and I have 1 child. Okay, what's your question? I'm ready. We're going to answer Cassandra's question, and then we're going to call it a day. She's 28, and she has 1 child. We know that much so far. What's your question, Cassandra? Oh, here we go. How old do you have to be to get your tubes tied, and under what circumstances? Do you have to be a certain age, amount of children? Good question. You got to be over 21, I think, or at least in Utah, you got to be at least an adult, so over 18. 28 is definitely old enough to say if you don't want more kids or not, in my opinion. Do you have to be a certain age? No. Certain number of children, over 21. Certain number of children, no. I think the main thing to understand about sterilization is it's permanent. And if you look at folks who are, say, under 30 versus over 30 when they make the decision to have sterilization, there are studies that show you have a higher risk of regretting it later in life, but it doesn't mean you can't do it. So that's how I counsel patients, is to say, look, there's studies that show that if you do a sterilization procedure under 30, then you have a higher chance that at some time in your life you'll regret the decision. And as long as you understand that, this is your body. This is your choices. So I'm just here to give you the information. I support your decision. We don't do sterilization at the office anymore. We used to do the Essure procedure. We're not doing that one anymore. It's not on the market anymore. But we do laparoscopic sterilization at the hospital. So depending on your insurance, either Ogden Regional or McKay would be where we're going. Let's see. Scarlett, let's see. And when your baby is born, would you be able to record to put on YouTube? Was there a question before that? And Scarlett, what's your... And when your baby's born, would you be able to record to put it on YouTube? I don't know if that's a question or statement or what, but I have done some birth story type videos that are on YouTube. Not so much anymore. They're actually a ton of work to make a good one. And also one of the hospitals that'll not be named kind of put the clamps down on me and basically said, here's all the things you got to do to make this legal with us. And it's more work than it's worth. So, but a patient can do it. You can record your own birth. It's fine with me. And the hospitals generally don't care either. So that's for you. But for me, it's kind of gotten to be kind of basically too much work. They made it too difficult. So yeah, cool. I think we're good. Cassandra, hopefully that answers your question. I think we'll call it good right there. Thanks to everybody who's watching or watched and had questions. And there you go. We'll catch some other Friday coming up down the road. So everybody have a great weekend. See, Nikki had, what'd she say? Doctor wouldn't do it. Nice price. Oh, there you go. Got a surprise baby. There you go. See, it happens. Okay. All right, guys. Have a good weekend. Thanks for watching. We'll catch you next time. Bye. Finish. End. Let's see. We'll answer this last question here on YouTube. 28 weeks, still smoking. Your OB said it's okay. No, it's not okay. There's no documented safe dose of all the bad things that are in cigarette smoke, whether that's, carbon monoxide or the nicotine or the 5 bazillion other carcinogens. So anyway, I wouldn't recommend smoking at all of any kind during pregnancy. So I'd get that 2 down to 0, and we'll stop it there. Thanks, everybody. Thanks for watching. Have a great weekend. Thanks for your questions, and we'll see you next time.